Yeah, no? Okay. Good morning, everybody. So, indeed, so I'm working for Philips, a health technology provider, so not only medical devices, but also a whole range of other software products that are used in a healthcare setting. When we reflect on the new reality of health systems, we are really thinking about healthcare as an increasingly and even more complex ecosystem that it has been over the last 200 years. Where we are now seeing a lot more data generated, used. Artificial intelligence certainly plays its role in that. So we are now in Philips spending more than 3/4 of our R&D on data analytics and AI, because a company that does not invest in that will not survive the 21st century. And we now see, after decades of development, piloting, failures, the real commercial solutions, not only on the market, because that's only the first step, but actually used in a healthcare setting. So I think latest reports by Dutch hospitals were that around half of them are now using artificial intelligence in their radiology departments on a daily basis. But that's not the only trend. We also see that healthcare is increasingly coming out of the healthcare delivery organizations. So more and more solutions that try to connect healthcare between the hospital, the GP practice, and the home, which also means, of course, that more and more devices that are not specifically developed for healthcare purposes or as medical device are becoming part of medical practice, phones, apps, what have you. And also, of course, it means that the risk environment is changing, because all of this has, we hope, incredible benefits for not only the patients, because that's first and foremost, we want to improve outcomes, but we also want, of course, to improve the experience of our users, the healthcare professionals. And then there are all of those systems benefits that I think are sometimes overlooked in terms of efficiency, cost effectiveness, and increasingly also environmental emissions, because I think that is in a time of climate crisis another element that we need to consider. However, risks exist, so I could talk a lot also about the entirety of our risk management system, but I was asked to focus on security, so that's what I'm going to do. And obviously, the increasing uptake of digital health solutions, also due to COVID-19, by the way, has also resulted in an explosion of cyber attacks. So we have had some spectacular, terrible cases in hospitals, especially cases of ransomware attacks, often induced also by phishing, have increased. And as we have seen in the previous presentation, the financial but potentially also human cost of those attacks is incredible. And I think that's really increasing the pressure on all actors in the healthcare ecosystem to do more on security. Now, security is not antivirus software. So technology plays its part. So certainly we as a developer and deployer of digital health solutions need to make sure that that software is designed with the needed security controls, and that we provide the necessary updates, upgrades, and security patches and everything that is associated with that. But honestly, if you want to strive for security, other elements of your organization are much more important. So the first one is certainly people. So in Philips, every Philips employee has to undergo annual both physical and cybersecurity training, which is role dependent based on how you engage with the software and with customers. And that is something that is also necessary, of course, on the side of our customers in the healthcare delivery organizations. It's also general awareness around cyber hygiene, because honestly, most cyber attacks are not sophisticated, technologically savvy hackers sitting in a room somewhere. A lot of, it's still, the very simple traditional phishing email where you're asked to click on a link because it looks like, your internal system, and then you give them your password and all of your personal data, which is then used to access internal systems. And that is the kind of thing that technological solutions can only address to a certain extent. And the last one is processes. I'm talking to a room of risk management, so you all know that. So you need to have the right processes in place, including elements like vulnerability disclosure, reporting of incident, and have those learning processes in place that the next attack can be prevented, because in the end the hackers are always going to be faster than us. So the threat environment is constantly evolving. So next to our enterprise level policy, I thought we also, of course, like for safety, like for performance, follow a total product life cycle approach for security, both, by the way, for our medical devices, but also for the software that is not a medical device. I'm not going into the details of all of the different steps in that life cycle, but maybe to highlight some aspects of it, here is first that the communication here between us and as a manufacturer and the users of our devices, because that's a very, very critical link here that we need to ensure also in the future. And that involves, of course, that we as a manufacturer provide all the needed information on the security controls of the device, for the secure use of the device, so recommendations on the intended use environment, recommendations on all the cyber hygiene practices needed, but then also to close the loop, we of course do 24/7 monitoring of the threat environment, so we rely on information that is coming from, for example, the suppliers of our software components. I mean, the classic example here is the Microsoft operating system. So if they detect a vulnerability, they inform us. We evaluate that vulnerability and then provide mitigation measures to our customers. But also, we also rely very much, of course, on our customers, reporting security incidents to us. That's a large part of the information that we need to then also, pass that on to the authorities. And so authorities is then maybe the key word here. So as we have seen, the regulatory environment for digital health solutions is changing at the moment. So the European Union has passed a number of legislations that are currently being implemented or will be implemented over the next years. Many of those include either direct or indirect security requirements. Some of those were already mentioned, but maybe to add to that, the GDPR, for example, has always included already security requirements, so we shouldn't forget about that. As a manufacturer of critical medical devices, especially ICU equipment, we fall under the Critical Entities Resilience Act, which is a directive that requires us to protect both against security threats, but also physical threats like earthquakes, terrorist attacks, and so on. And then also in other legislation, we find those security requirements. So this is definitely going to increase the state of the art for what security in healthcare actually means. across different products. So again, this is not just medical devices, but also other types of software that are used in a healthcare setting. So the EHR systems that will be regulated by the electronic health data space, other software, enterprise software that is used, but also cloud services. I mean, as Philips, we are actually producing software and services in all of those categories. I'll be honest here, there are some challenges associated with compliance to this legislation in the next few years. So we are currently trying to figure out the incident reporting mechanisms, because all of those legislations require incidents reported to different authorities and different databases. So that is one thing that needs to be, spelled out in the next few years to make sure that, again, it's not so much about the burden on us, but really that the information that we are providing is reaching the right people and is actionable in a fast and efficient manner. So I think the next few years you will see an increase in what manufacturers are going to do on security. So the rest of the market is going to keep up. But certainly also the obligations on healthcare delivery organizations, including hospitals and others, are increasing, and we all will need to be investing more to raise the level of security in the healthcare systems. Thank you.
Thank you very much.